So you're a healthcare professional, and now you're going to go start up your office. So let's go slow and kind of walk through the various steps and chapters of the process so you will understand how this process works. First thing that you have to do is locate your space, whether you're going to lease it or whether you're going to purchase it, whether you're going to buy land and potentially develop your own building. The first thing is to locate. So one of the first things we tell our clients always, regardless of their profession, is if you're currently working for someone, whether it be an employer or you're working, let's say, for a health system, do you have any restrictive covenants with your employer? Specifically, many times, if you're a healthcare professional, your boss will say that if and when you leave, you have to go at least 3, 5, sometimes even 10 miles away from where you currently are. That's called a restrictive covenant, and that's actually done by a radius. So it's not a MapQuest or a Waze calculation. It's as a crow flies, as they say in the court system. So it's a long way. So if you're in downtown Boston and you have a 5-mile restrictive radius covenant, you're not going to be able to open up your new office in downtown Boston. So it's a critical point to consider when you're in this process. My advice to you is if you are looking for an associateship job, do not agree to a restrictive covenant. If you have to, then try to be proactive enough to know that if you're going to want to ultimately end up in downtown Boston, take a job in the suburban area of Boston. Be 10, 15, 20 miles outside of town so that you know when you do leave that employer, the restrictive radius won't affect you. Why is this so important? If you're an associate and you've been with your employer 2, 3, 5 years, you've honed your skills, you've built a patient base, why would you throw that all away and now not be able to start up your office in that location where you've made a name for yourself? So again, try not to sign a restrictive covenant, and if you do, try to be prudent and proactive that you take a job where you're almost certain that you're not going to want to end up.